Hi and welcome to Dearson Veterinary Products. In this video, I want to explain a little about the disease EOTRH and show how I extract the incisors. I am an avatar of Jesper Rosenmeier. Jesper is a veterinarian from Denmark working only with equine dentistry, and he has the company Equine Dental Products that is distributing Dearson products to most of Europe. Jesper is also a partner in Dearson since spring 2024. But let's get back to EOTRH. Equine odontoclastic tooth resorption and hypercementosis, or EOTRH, is a progressive and painful dental disease that primarily affects older horses. But I have personally seen it in horses 11, 12 years old. This condition targets the incisors and in some cases the canine teeth. Personally, I have never seen it in the cheek teeth, but it is seen in rare occasions. EOTRH is characterized by two distinct yet interrelated processes: tooth resorption and hypercementosis. Tooth resorption involves the breakdown of a tooth's internal and external structure, leading to fragility, cavities, and eventual tooth loss. Simultaneously, hypercementosis causes the excessive production of cementum, the material that covers the tooth's root, leading to irregular swelling and deformity. Together, these processes result in structural instability, pain, and infection. Early detection of EOTRH can be challenging as the condition often progresses silently. Over time, however, horses may exhibit noticeable signs such as difficulty grasping food, reluctance to chew, or dropping feed while eating. Additional symptoms include excessive salivation, weight loss, resistance to having their mouths handled, and the development of swellings or draining abscesses along the gums. Often seen clinical signs are the appearance of inflamed gingiva, fistulas, loose teeth, retraction of the gingiva, and painful gingiva when palpated. Radiographic imaging remains the gold standard for diagnosing EOTRH. X-rays reveal the extent of resorption and hypercementosis below the gum line, confirming the need for intervention. Leaving diseased incisors untreated poses significant risks to a horse's overall health and well-being. In the advanced stages of EOTRH, the affected teeth become a persistent source of pain and infection. Chewing and eating become uncomfortable, which can lead to malnutrition and secondary health issues. One of the most critical reasons for extracting these teeth is to eliminate chronic pain. The resorption process exposes sensitive areas of the tooth, making even light pressure excruciating for the horse. Infections that develop around these compromised teeth can spread to other oral tissues and even into the jawbone, causing more extensive damage. Additionally, diseased teeth are non-functional and may cause more harm than good if left in place. They become unstable and prone to fracturing, creating further discomfort and increasing the risk of secondary infections. Extraction allows the horse to adapt more comfortably to chewing with other teeth and alleviates the strain of trying to use painful or non-functional incisors. Owners often notice a marked improvement in their horse's behavior and appetite following the removal of affected incisors. Horses with EOTRH frequently experience significant relief from chronic pain, allowing them to eat and interact more naturally. Despite the loss of their incisors, horses can continue to live healthy, functional lives, relying on their molars for chewing and processing food. Extracting diseased teeth is a critical step in managing EOTRH and preventing further complications. By addressing the root cause of discomfort, veterinarians can restore a horse's quality of life and ensure they remain pain-free. Having a good analgesia is crucial to have a good and easy extraction. This is, of course, because you want the horse to be pain-free during the extraction, but also because the extraction is much easier if the horse doesn't move. For many years, I have used the mental foramen and infraorbital foramen block. I have always found these blocks a little tricky, and that is why I changed to the intraligamentary block some years ago. These blocks work very well and are much easier in my hands. You will need an intraligamentary pistol and needles for the pistol. The needle must be advanced into the alveoli and in the gingiva around the tooth. If the plan is to extract all incisors, the first tooth is normally anesthetized when you have done the intraligamentary anesthesia around the last one. But let's watch the video of the extractions. In this video, you can see how I do the extraction of the incisors. How easy you can do the extraction will depend on how diseased the teeth are and in what way. I always use the spreader between all the teeth first. This is to get some space for movement of the teeth, but also to test if my block is working. When the spreading is done, I use my elevators. I normally use my wolf tooth elevators in combination with some more wide elevators. And instead of just putting pressure on the elevator, I often use a hammer. The hammer just makes the elevation procedure easier, and I consider it to be more safe if the horse moves its head, as you don't have force on the elevator that you can't stop. I give the horse anti-inflammatory medicine at the same time as I start doing the local anesthesia of the teeth. I never, and I mean never, give horses antibiotic in relation to incisor extraction. I have done a lot of incisor extractions, and I have never experienced a problem in relation to infection after the extraction, and in general not really any problems. So my advice will be not to use antibiotics. I normally ask the owner to give anti-inflammatory medicine again the same evening as the surgery, and then every morning for the next 4-6 days. I also ask the owner to take the horse home straight after surgery, as I don't see any point in the horse staying at the clinic. I explain the owner that there will be a foul smell from the area because of food stuck in the holes, but that it is not related to infection in the horse. I also explain that if they can remove the food from the holes, it is fine, but if not, that is also okay, and that the wound will be healed in 4 to 6 weeks. Depending on the owner, I will arrange a control visit in 3 weeks' time after the surgery. In my opinion, the horse can be ridden gentle after a week's time if the owner thinks everything seems fine. If there is a lot of bleeding, I might use spongostan in the alveoli to try and stop the bleeding. With minor bleedings, I put swabs in the alveoli and just remove them before the owner takes the horse home. But in many cases, I just leave the minor bleeding to stop by itself. I hope you found this video interesting and got some useful information and tips. You can buy intraligamentary pistols, needles, and different types of elevators and forceps at Dearson Veterinary Products or Equine Dental Products. Thank you very much for watching and good luck with the extractions.